Hello and welcome back to our show on lung care, Voice for Lungs. In today's episode, we have with us Dr. Abhishek Raj, who is a medical oncologist. Welcome, sir.
Thank you.
Sir, I have a question for you. How harmful is smoking at an adolescent age?
So, smoking at any age is harmful. So, the thing is that generally the adolescents, they start smoking at an early age, probably because of the pressure, probably because of the peer pressure, or some of the stress. And it has been known that smoking can cause many types of cancers. It can lead to increased stress, and usually smoking leads to addiction because of addiction to a substance called as nicotine. So it leads to physical as well as mental dependence. So what it leads to is that they find it hard to quit. It leads to mental health problems, and of course it leads to increased risk of cardiovascular diseases, and
Right.
it also leads to increased risk of almost 10 to 12 different types of cancer.
What can be the reasons? Why do people smoke?
So, as I briefly mentioned in the previous answer, that the reason for smoking can be manifold. Usually, it starts with a whim that, okay, let's try something new. Because the onset of smoking is usually seen among the teenagers or in early 20s, when they are usually going to the school, or maybe they are going to the college. Then there is a peer pressure. Another thing which I have noticed is that smoking leads to some kind of bonding. There are like 5 group of friends or 6 group of friends. 1 or 2 of them are non-smokers. They'll probably not bond well with the ones who are the smokers. So it is again a peer pressure that, okay, this guy is smoking, so let's smoke. So another reason is, yes, it can be because of stress. The stress can be in the form of personal stress, work-related stress, or family-related stress. And once you start smoking, you get dependent on them. If you don't smoke, you start feeling irritable, you start feeling depressed. So these are some of the common reasons why people smoke. Some can find it difficult to have their bowel movements without smoking. Some can find it difficult to initiate the sleep also without having the smoking. So these are some of the common reasons why people are smoking.
Does it actually work with stress?
There are no studies to prove that, but people feel that, okay, that probably if you're smoking, that probably this is a way to release the stress. There are no medical trials or studies to prove that, okay, smoking leads to decreased stress.
Right. So, what are the consequences of early tobacco exposure?
So, if you're getting exposed to tobacco early, as I mentioned before also, that it is a harmful substance. You get addicted to something called as nicotine, and nicotine leads to dependence. So, dependence, it can be in the form of physical dependence. What I mean by physical dependence is that if you're not smoking, you'll start having some symptoms like tremors, you'll start having palpitations. So these are the signs of physical dependence. Then there is mental dependence, that if you don't get your nicotine or dose of nicotine, you'll find you'll crave the cigarette more. So that is what happens, that if you don't smoke for some time, maybe few hours, the craving for smoking is probably more when you go smoking again.
Correct.
So this is something called as mental dependence. That is why you find it hard to quit. Many people might not know it, but nicotine is not a carcinogen. So carcinogen is something which causes cancer. Nicotine does not cause cancer. So nicotine only leads to the dependence. And the other substances which are rolled into that smoke, cigarette or the BD, so that is what causes cancer. So cigarette smoke contains many carcinogen and can lead to many cancers. Particularly if you are the duration of smoking, like if the patients, if somebody who has smoked for 50 years, his risk of developing a cancer, heart disease, or other smoking related problem is higher as compared to somebody who smoked just for 5 years or 10 years. So the duration of smoke also matters. So that is why if you're starting early, your lifetime risk of developing smoking related diseases increases. So there are 12 different varieties of cancer which can happen because of smoking. If you're starting from mouth, so oral cavity, larynx, your food pipe, which is esophagus, stomach, pancreas, kidneys, urinary bladder, and even blood cancer called acute myeloid leukemia, these can happen because of smoking. Then you have your symptoms of depression. Mental illness can also happen because of exposure to smoking. And then your increased risk of heart diseases, your something like your angina, myocardial infarction, your stroke, brain stroke, these are all increased by exposure to smoke.
So, clearly, quitting is the right way to go about it. But how can one
Absolutely. So quitting might not be very easy. It is much easier said than done. हम लोग भी अपने ऑफिस में बैठते हैं, हमारे पास पेशेंट्स आते हैं who are like smoking for a long time. We just tell them very casually that okay, cigarette पीना छोड़ दो. So it doesn't work like that. There are often professional ways to help it out. So there are professionals who help you quit the smoking. There are de-addiction centers which help you quit the smoking. There are medications to help you overcome the dependence that you get from nicotine. There are nicotine patches and gums. You know, I told you before that nicotine is not which is causing the cancer. So nicotine replacement gums and patches are available. Makes the craving for smoking less likely. Then you can distract your mind by doing something else. Whenever you have a sudden urge to smoke, maybe you can engage yourself in some physical activity or something to distract yourself. Somebody is a painter, he wants to do painting. So these are some of the methods which have been proven in studies to reduce the smoking. And often whenever you go and seek help, they'll probably tell you that suddenly quitting smoking is not going to work. So maybe if somebody is smoking 10 or 20 cigarettes a day, maybe he can reduce to 18, 16, 14 slowly, and slowly you can probably come back to the normal.
Time to hop on to another segment where we have come across a lot of myths around lung cancer and smoking. Let our doctor tell us if they are true or not.
Yeah.
So first myth is only smokers get lung cancer. Is it true?
No, absolutely not. Smoking is the majority or it's the major risk factor for lung cancer. If I have to tell you the figures, so probably 80% of lung cancer can be attributed to smoking. But there are factors, something called a second-hand smoke. If somebody is a non-smoker, but suppose a family member smokes, so he get exposed to that second-hand smoke, which can cause lung cancer. Plus, there are certain genetic predisposition also. Those patients can also get lung cancer. And then there are exposure to indoor pollution gases like your radon, outdoor pollution, exposure to asbestos chemicals, like people who are working in an asbestos factory, they can also get lung cancer.
So the second myth is smoking low tar or light cigarettes are safer. Is it true?
So light cigarette is something whose nicotine content is less. I think I've previously explained that our brain is dependent on certain amount of nicotine. So what happens is that if you are smoking a low tar cigarette or a low nicotine cigarette, so your body compensates by taking a deeper drag, or maybe smoking higher number of cigarettes to compensate for the amount of nicotine that your brain needs. So nothing is safer. Even the low tar or even the e-cigarette is not safe.
So the third myth is that quitting smoking later in life won't make a difference.
So no, anybody, there is no age or no right age to quit. Whenever a person wants to quit, he can quit and it will be beneficial. In fact, it is said that people who have been smoking, if they stop smoking, in just few years, his risk of developing lung cancer starts to decrease. And after a few years of continued non-exposure to cigarettes, his risk of developing lung cancer is almost as less as a non-smoker. So we do have a category of patients who are called as never smokers and who are former smokers. So, and even the risk of other diseases like your cardiovascular diseases, like your other problems which are related to smoking, they also decrease. In fact, you'll be surprised to know, कई पेशेंट मेरे पास आते हैं बोलते हैं डॉक्टर साहब अब तो लंग कैंसर हो गया है, अब हम स्मोक करें ना करें क्या फ़ायदा, अब मैं नहीं छोड़ूंगा. So at that point also we try to explain them that if you continue to smoke while your treatment is going on, the efficacy of your treatment decreases, the efficacy of chemotherapy, radiation therapy, and even the ability to recover from the surgery, that also decreases. So even a patient who has already been diagnosed with lung cancer, for them also it is recommended to quit smoking.
So we have heard that consuming smokeless tobacco products are safer alternative to smoking. Is it right?
No, tobacco in any form is going to be harmful.
True.
So smokeless tobacco are like your kheni or your pan masalas which contain tobacco. So they also lead to increased risk of oral cavity cancers, your cancers of the throat, your cancers of the... So tobacco in any form is harmful. Even when you're not smoking it, then also there is an increased risk of lung cancer also. So tobacco in any form is not safe.
So is it like lung cancer only affect older individuals?
That is also not true. Yes, the incidence of lung cancer is higher in people who are elderly. Like if we look at the data that is available from India, I think the median age of patients who are diagnosed with lung cancer is somewhere around 60 years. But particularly in the past 10 years, 15 years, we've seen in the last decade and a half that patients are getting diagnosed at a much younger age. Even patients in their 20s, 30s or 40s are getting diagnosed with lung cancer. A lot is to do with, which we discussed earlier, that the patients are, or the people are starting to smoke at a much earlier age, and there are other factors also. They are getting exposed to other chemical carcinogens, they are getting exposed to the outdoor pollution, which is leading to the more risk of lung cancer, even at a younger age.
So coming to our last question, sir, is there no way to detect lung cancer before it starts causing symptoms?
It's true that by the time lung cancer starts causing symptoms, the common symptoms of lung cancer are cough, shortness of breath, sometimes blood-streaked sputum or chest pain, or if it spreads, it can cause a variety of symptoms. But usually it is seen that before it starts causing symptoms, they're already in a much advanced stage. If I tell you about my practice, I see almost 60% of my lung cancer in stage 4, because by the time they develop symptom, it is already much advanced. But it's not true that it cannot be detected at an early stage. But there are a lot of caveats. There was a big screening data that was available from the Western world, that people who are heavy smokers, who have smoked heavily in their past life, between the age of 50 to 80 years, if you do a low dose contrast CT scan of their chest, you might be able to detect it much earlier. But there are a few caveats to it. The reason being that in India, the other infections like your tuberculosis, they are much more common. And even those tuberculosis infection or other infections in the past, they can lead to small nodules in the lung. So there can be over investigation. Suppose you detect a lung nodule while you are doing a CT scan, then what will you do? You will refer the patient to a pulmonologist or a physician that, okay, there is a nodule in the lung that I have detected on the CT scan. So the data that is available from the West, that might not be applicable to India. So screening has got some role in preventing the mortality of lung cancer, but it has got its own potential problems. It might lead to over investigation, and yes, if your doctor is telling you that there is some nodule in the lung, आपके lungs में कोई छोटी सी गांठ है, so it can lead to a lot of scary situation for the family. They'll be very anxious that okay, क्या है? They might need to undergo certain investigations which might not be required. So we have to take the screening of lung cancer, particularly in Indian setting, with a pinch of salt.
Dispelling myths and promoting truths about tobacco's impact on lung cancer is essential for raising awareness, encouraging smoking cessation, and driving prevention efforts. By understanding the true risks associated with tobacco use, individuals can make informed decisions to protect their lung health and reduce their risk for developing lung cancer. Thank you for watching this episode of Voice for Lungs. Thank you, Dr. Abhishek, for joining us.
Thank you so much. It was a pleasure. Thank you.